Hi there, I thought I'd jump on and talk to you about Diastasis Recti, which is the unnatural separation of these recti muscles, of the core muscles, the external core muscles that can be seen on ripped guys as a six-pack. So these external muscles, they are brought together in the midline here in this seam down the center called the linea alba. And they kind of feel like two ridges. If you put your knuckles like this, they feel like ridges. And most of the time on kids and people who haven't had babies, they tend to be quite close. Maybe a centimetre, maybe 1 finger apart, maybe 2, but not generally wider than that. And the muscle fibres between them is this linea alba, is this sort of this fascia which is very, very strong, and it's designed to stretch kind of that way, but not so much that way. And in pregnancy, for some women, and often it's because of underlying postural stuff and the rib cage flaring, where they have a bit more intra-abdominal pressure that pushes these muscles apart, and they can be left with this quite significant gap sometimes. And sometimes you can feel into the gap, and you can feel right down into the deep core muscles, the deep transverse abdominal muscles that haven't been toned. So it all feels a bit squidgy in there, and you can almost feel right down into the intestines. And it's important to work on bringing these muscles back together, as it is on strengthening the pelvic floor muscles, because they're all part of our core. They all stabilize the spine, stabilize this very, very important part of the body, and obviously we don't want to be tweaking lower backs. This is very much a symptom of pelvic floor dysfunction as well. So we want to make sure that if we have given birth and we have been left with a more significant gap, or if we've put on a lot of weight and maybe that's the reason why we have this bigger gap, or maybe there has been kind of inappropriate exercise done over a period of time which just kind of pulled those muscles apart, then we want to be looking at things we can do to close that gap, and at the same time very much strengthen the deeper core muscles and the pelvic floor muscles. It all comes in with the breath and using the diaphragm to breathe properly, breathing underneath the armpits into these intercostal muscles, and connecting the breath with the pelvic floor as well. So how do you check for tummy separation? You can kind of feel when it's everything's a little bit loose, and you just don't feel like you are being supported well with your corsatory muscles without actually even checking. But I'll show you what to do to check, to see what kind of gap that you might have. So we'd lie down on our backs, and if you have given birth after a couple of weeks, worth having a check, writing down how far apart those muscles are, and then doing restorative work, and then checking again in a couple of weeks' time. There's no point just poking around the whole time at all, but do the focused work and then recheck. So what you do is you look kind of on the tummy button line, above the tummy button and below the tummy button. So you just need to draw your pants down a little bit, and you want to go crossways, because of course we're looking for how far those muscles are apart. So taking your fingers, and we're roughly about 1 centimetre and 2 centimetres, like so. Maybe there's 3, maybe there's 4, maybe there's a whole fist that you can put in there. It's all very, very common. Not normal, because we do want to be able to bring those muscles back, but very, very common. So to start off with, take the fingers just above the tummy button, about here, and you just take an exhalation. As you exhale, you take your head up off the ground, so like that. And you basically feel, so I've got just under a centimetre there, you feel for how wide those muscles are apart, and you also feel, I'm just going to take my head down, you also feel to see what the quality of the muscle fibre is like. So if you can kind of sink your finger right down and it disappears to, a knuckle or further, then we know that we've got some real toning to do on those deep transverse abdominal muscles. But if it feels more like the pad of your hand here, relatively firm, you can't go that far down, then it looks like your deep transverse abdominal muscles are doing all right. And actually you can have a functional gap where it remains a bit wider than ideal, but the deep core muscles are strong, and therefore, unless it's actually causing you lower back pain or you have associated pelvic floor dysfunction, I actually wouldn't worry about it too much. I think we get quite hung up on close the gap, but actually you can manage it very, very well with a little bit of a gap. Okay, so let's take the fingertips down, actually kind of on the belly button. And this is sometimes where you feel a hernia because pressure which has gone into this weakened seam is also kind of basically pushing your intestines out here. So you can sometimes feel a bit of a bulge, and that is something to be wary of and something that you do need to take care of. So let's just take the fingertips onto the tummy, and same thing, as you exhale, just taking the head up off the ground. Okay, so my gap's a tiny bit bigger there, so you just feel between the, like I said, between the ridges of the two recti muscles, but quality is okay underneath. So then take the finger down a little bit further, so just sort of above the bikini line, between tummy button and bikini line, and then exhaling to come up and just noticing what it's like there and coming back down again. So those 3 spots you check, and then you want to do the work and then come back and check again. So when I say do the work, what we're looking to do is start to really activate the deep transverse abdominal muscles and the pelvic floor muscles. And that is the primary thing you need to do before you kind of work on drawing these muscles in as well. So that's getting the breath coordinated with the pelvic floor. And we do this on an exhale. So we breathe in to expand the breath into the belly and into these intercostal muscles. So very much sort of down and out. And then as you breathe out and you draw the base of the ribcage slightly in and you push the breath out of your lungs, at the same time you want to try and gather the pelvic floor muscles in and up and zip all the way up, almost right up to the tummy button, and let all of those corsetory muscles suck in towards your spine. And then you release it all out again. So it's an exhale to draw in and zip up and suck inwards, and then it's a release all the way down. So I'm just going to get on my back again and show you that, and then also show you how you can draw your recti muscles in as well. So we'd start off making sure knees above ankles. You can always lift your head slightly on a pillow if you find that lying here makes your head tilt back. So to start off with, we want to breathe in here to the intercostal muscles, like so, and then as you breathe out, you are gathering the pelvic floor muscles, zipping up and letting everything suck inwards. So it's a kind of 4-part breath. You draw in and then you zip up, you suck everything in, and then you sort of almost push the base of your rib cage inwards. And what we want to do once we've got quite strong underneath in those deep transverse abdominal muscles in the pelvic floor, to help then slide those recti muscles closer together, what you can do is either with your hands or with a sort of a belt or I sometimes use a scarf, so put a scarf underneath you, cross it over the body, so it literally pulls the skin and pulls those muscles into the midline. So I'm just going to do it with my hands at the moment. I'll put my top up. So you take your hands across the recti muscles, you breathe in, breathe out completely as you take your pelvic floor muscles in and up, all the way in and up, and then you draw your fingertips across, stopping right where that gap is, and at the same time you lift your head upwards and then drop down. As we lift our head up, it's the recti muscles that have drawn in, but what we want to do is make sure that we've got that quality contraction sucking in towards the spine, sucking up from the pelvic floor before we do that. So it's a exhale to draw in, zip up, draw everything in, and then we literally pull those recti muscles together and kind of consolidate by taking the head up off the ground as well. Really important before you're doing this stuff that you actually are working first of all on the deeper layers of muscle. Okay, so we set like so, breathing in through the ribs and lower belly, breathing out completely. And then release. Breathe in, setting again. Breathing out, pelvic floor, lifting and the midline and head comes up. And then all the way down again. So really important, like I said before, is to get the pelvic floor drawing in and up, and then sliding across, and head comes up like so. Now, the other thing to be very, very aware of is that you're not repeating the same postural issues that might have caused or been an underlying factor in having those recti muscles pulled apart in the first place. So really important when you're standing or when you're sitting to drop those floating ribs, which are the ribs that don't actually attach onto your spine, the base of the rib cage. Drop them downwards. So many of us stand with ribs slightly flared and a bit more of an arch, not just in the lumbar spine, but right up here into the thoracic spine. We're sort of pushing forward, shoulders slightly back and head slightly tilted up. And quite often this is accompanied with the pelvis pushed forward as well. So just be very, very wary that you're not hyperlifting through the ridge of, through the ribs here. If you are, you'll probably be aware of compression or just discomfort in your mid-back area here, and quite often around the sacrum as well. And instead, drop the base of the rib cage. You'll need to sort your head out so it's not kind of sticking forward. You'll need to draw the chin in and lift up through the ridge of the head. But we're looking to have our ears sitting on top of our shoulders, sitting on top of the hips here, and then if we're standing, dropping down through knees and through ankles. So here I can feel corsatory muscles switched on. Here, it's all destabilized, it's pulled apart. So just be very wary of your posture, your breathing, and then working on that pelvic floor and deep core activation, and your recti muscles should come together bit by bit, relatively quickly, and you can always just increase that healing by doing that cross pulling and the head drawing up at the end of your pelvic floor contraction and lift.